When there's news in the medical field, it helps to have someone on hand to bring us up to speed on everything. Dr. Scott Ackerman is one of the First Coast leading oncologists, and he joins us every Friday to talk about important health issues. And today, he's going to fill us in on a new study that links prostate cancer to obesity. Dr. Ackerman.
Nick, good
to see you.
Thank you, sir.
I've missed you all this time, and now we get one day together.
There you go.
But it's
all these months
good.
gone and then one day.
Let's talk about this new study that just came out.
Well, researchers are always looking at prostate cancer and trying to identify specific risk factors for prostate cancer. And recently we found an association between the body mass index, BMI, which we talk about a lot.
Yep.
We talk about that about diabetes and heart disease.
Ties into so many things.
So many things. And now we find that there's a link between body mass index and prostate cancer. So we looked at 1,800 men who have a body mass index of over 30 and compared it with a control group of a similar number of men who had a body mass index, a BMI, under 25. And they found out, so 20 to 25 is normal,
Okay.
25 to 30 is overweight, and over 30 is obese.
Okay.
So the obese, over 30, compared to the normal between 20 and 25. And we found out that obese men, when they're diagnosed with prostate cancer, their prostate cancers are usually a more aggressive type than tumors in non-obese men.
Okay. Now, how exactly does obesity and the obesity rate play specifically into prostate cancer?
Well, we looked at obesity in many diseases, and one thing we found out with breast cancer was that the fat cells release certain hormones. So fat cells in men, as they do as in women, release the hormone estrogen in the body, and you have higher levels of estrogen. Higher levels of estrogen are associated with higher grade tumors and more aggressive tumors. So again, like breast cancer, where women who are obese have more estrogen, they have to have a higher incidence of breast cancer. In men, if there's estrogen present and they have prostate cancer, it tends to be a more aggressive type of prostate cancer. So that's number one. Number two, the obesity in of itself makes prostate cancer more difficult to find. It's much more difficult to do a rectal examination in a man who's obese, and obesity, and because of the estrogen levels, it can affect the PSA levels. So estrogen is a drug we used to give men with prostate cancer to lower their PSA. So if you're obese and you're producing estrogen in your body, your PSA levels may be artificially low. So if and when you're diagnosed with prostate cancer, the PSA level may look low, and you may think that's a slow-growing tumor, but in fact, it's a much more aggressive tumor because that estrogen caused the PSA level to go low.
So obesity then is something that us men should add to our list, which is a little bit of a list you got going, things that put us at high risk for prostate cancer.
Well, the things that put us at high risk now are being African American, puts you at high risk, and a family history of prostate cancer. But obesity isn't really plugged in there just yet. So that's what's being looked at now.
Okay.
Do we add that as a risk factor for prostate cancer? I think we should, because when we look at risk factors, the way we act on those risk factors is by instituting prostate cancer screening more early in life. So we generally recommend that men over the age of 50 have a PSA and a digital rectal examination every year, but those men that are high risk, African Americans, men with family history of prostate cancer, we recommend that start at 40. So now I would add, my recommendation would be that men who are obese also consider starting their prostate cancer screening a decade earlier at age 40. Prostate cancer screening is painless. Digital rectal examination is uncomfortable, but it's not really harmful. You're not going to get an infection from a digital rectal examination or a problem like that.
So this is definitely something that we should absolutely be ahead of. We should make sure that we get checked. And again, us guys, we get kind of proud sometimes, and it's like, no, I'm going to be okay. Everything's good. Based on this new study, what would you recommend for us?
Well, in general, stay on top of your cancer screenings, colonoscopy for colon cancer, PSA and digital rectal examination for prostate cancer, and this whole BMI thing causes all sorts of problems with diabetes, as I mentioned before, heart disease, and now we know prostate cancer. So keep your BMI within a healthy range. Exercise, work out. It's certainly much better to minimize your risk for developing a cancer than diagnosing it early and having to treat it. Now, so that's the order. Right, you want to be ahead of it and eliminate the fact you're even going to get, or minimize the risk you're going to get it. Or if, God forbid, you're going to get it, diagnose it early. So Be proactive.
Dr. Ackerman,
Nick,
as always,
good luck.
I love you.
Thank you. Love
Good
you
to
too,
see you
man.
again. Thank you for all the information and for sponsoring this segment. And you want to make sure that if you have any questions regarding this topic or any other health questions that you might have, visit Dr. Ackerman's Facebook page, facebook.com/Ackerman Cancer Center.